Hi and welcome back to the channel. If you're new here, please remember to like, share and subscribe. If you're old here, you're oldie but goodie, please remember to like and share with your friends. Now, on this channel, we talk about everything books, university medicine, and mainly books because I love books. Anyway, today we're going to talk about a book. I'm going to mix it with something medicine. The video is actually about the book because I got a new book. So I went, as you all know, I'm a nurse practitioner, an advanced nurse practitioner, and I work in general practice sometimes. And I get people who come in a lot of the times with things like being tired all the time. One of my biggest concerns from patients is that they're tired all the time or they're fatigued. And as I just had COVID, I was so fatigued and malaise, I literally couldn't get out of bed some of the days. So I thought I'd talk about my new book and then I'll talk about how to use the new book to talk about symptoms and check facts and stuff like that. So the book I'm going to talk about is a book called, can you see that? SYMPTOM SORTER. And it's from Radcliffe Press. No relation to me, probably does. But no relation to me. So Radcliffe Press, and it's called SYMPTOM SORTER. It's really, really interesting book. I just did an update on prescribing. There's been a Nurse and Midwifery Council update on prescribing, and when I did the update on prescribing, one of the books that was recommended was the SYMPTOM SORTER. So I didn't buy the newest one. I bought the 5th edition. Always save money if you can. 5th edition, yeah, always save money if you can, because obviously everything is about saving money. And what I got here is an Amazon voucher. I received an Amazon voucher for £25 when I got the book. So that's good, you know. It's always good to get something free. £25, a lot of money on a gift voucher. So what I will do is I'll find something on Amazon and spend my £25 on. So SYMPTOM SORTER. So basically, in general practice, so a lot of patients will phone me or come in to see me and they will diagnose themselves. They will say to me, I think I have cancer because I looked on Google. I'm tired all the time. I look on Google and Google says it's cancer. Or I think I've got a chest infection because I'm coughing all the time. And I looked on Google and Google says if you're coughing all the time, then you have pneumonia or something like that. So it's for us now as clinicians to draw out the symptoms from the patient. So what I always encourage my patients to do is to never come to see me with a diagnosis, come to see me with their symptoms. So that's our job, to take a history, and in taking a history, we're taking a symptom history. So unfortunately, we have to diagnose the patient. The patient it shouldn't diagnose themselves, because of course errors could be made because they're mainly looking on Google. So this book, it covers over 100 symptoms. It talks about everything from anxiety to your hip pain, your knee pain, to how to explore red flags. It also gives you top tips and gives you like ideas of what might be the most common disease with the symptoms that you get from your patients. And sometimes none of us are perfect. Sometimes you forget things. And I always encourage my students, if you forget something, go and check. Never assume anything. Assumption is for dummies. Say, I don't actually remember, or I don't know, and you go and you find your answers from your medical books. Okay, so this book, I really love it, and I would give it a 9 out of 10. 9 because it's so heavy to take around, and because I don't have my own office, then I can't leave a book in the office, and I have to take it around in my bag when I do my clinical work. So that's the only reason why. I mean, there's no way to sort out a book being heavy now, is there? But the format is absolutely top. Really, really good format. And I recommend it for GPs, for GP registrars, for nurse practitioners, for practice nurses, any nurses, everyone. I really recommend it for everyone. I think once you're a clinician, you should really have this book. If you're a clinician in London, in the UK, I'm sure they sell it outside the UK as well. I'm not sure. I'm not sure, but it is certified as well, and I love it. So what I'm going to do is, I thought I'd talk about tiredness. I had a conversation with someone about them being tired all the time, and I made a quip about, oh, you're tired all the time, that's because you work too hard. But you know, sometimes you're tired all the time and you don't work too hard. So let's, without further ado, I think I didn't mark it, but it's page 224. Let's have a look at 224, and I'll show you what I mean when I say it's really, really easy. 224. Yeah. So it's really, really easy to follow as a clinician if you have your patient sitting in front of you. And I know sometimes clinicians don't like to use books with their patients there, but I'm never ashamed to use a book. I'm never ashamed to say, actually, I can't remember. I'm never ashamed to say, let me check my medical text and see what they say for a second opinion. I'm never ashamed to say I don't know. It's actually a good thing. So we're talking about tiredness. So it's got tiredness there. It lists what your GP will be looking for. It lists all the differentials. So differential diagnosis is other things that it could be. So it lists all the differential diagnoses. It lists the ones that are very common. It lists the ones that are occasional. You probably, better there. It lists the ones that are very common, occasional, and rare. So usually we look for the very common ones first, and then if those come back normal, then we move on, and sometimes we mix them. Sometimes we look for very common and rare. So it says tiredness. Feeling tired all the time is such a common presenting symptom that it has become a universal GP concern. In around 85% of first consultation, the cause is apparent at the end. So sometimes what they're saying here is, in 85% of the patients, so if you see 100 patients and 100 of them comes in for tiredness, at the end of our consultation, we will know the cause 85% of the time without doing any form of testing. However, sometimes it's very important, even if we think we know what the issue is, like when I said to my friend, it's because you work so hard. Even though I'm saying that, it's also important that you do some checking. And what checking does, you know, like do some tests and stuff, is that it gives you a clear idea, and it also confirms your diagnosis. So you might be thinking, maybe this person is anemic. It could be anything, you know. They could be depressed. It could be if they're females or having their period. Of course, we are talking about anemia. There's lots of people with fatigue. Post-viral fatigue is what I'm going through at the moment at the end of my COVID. And it could be their thyroid, it could be diabetes, it could be so many things. So what we tend to do is we think about all the things it could be based on your symptoms that you've given us. So if you say things like, I am having diarrhea all the time, abdominal issues, we might be thinking celiac, IBS. You're going to the toilet all the time at night and you're losing weight, and you know you're not wanting to lose weight, we might be thinking diabetes. So it depends on what it is, and then that's how this book works. What it does as well that I like, it also gives possible investigations that you can do. So it gives, I know it's not very good in the light, but it gives investigations like doing a urinalysis, doing a chest x-ray if they're coughing as well, urinalysis if they're going to the toilet all the time, blood tests for your ferritin, HbA1c, FBC, TFH, all these different things, and then it gives you top tips as well. And I love the top tips that it gives, because it says tiredness is a presenting symptom in the absence of other significant volunteered symptoms, particularly weight loss or weight gain, is unlikely to have a physical cause. Isn't that something? So if you're tired all the time, you're not losing any weight, you don't have any physical symptoms, then they're saying that if there's no physical cause, then it's mental. Basically, they're saying that it's mental. So it gives you little ideas, like make sure you make eye contact with your patient. Make sure you talk to your patient like they're a human being. Make sure that you smile at your patient, ask relevant questions. Don't allow the patient to leave your room feeling like they've been a burden, basically, because you've seen 100 patients with tiredness already, and here comes patient number 101 and you're just annoyed. So that's what I like about this book. So that's Symptom Sorter, and even student nurses, I think, should have this, because when you come across things on the wards that you're not sure of, you can actually have a look in this book, and this book can give you a general idea of what's going on. So that's the book, Symptom Sorter, for you. Thank you for watching. If you purchase this book, let me know. If you have this book, let me know what you think about it in the comment section, and talk to me in the comment section and tell me if you find a video like this helpful in terms of recommending a medical book. So thanks again for watching. Please remember to like, share and subscribe.